Hi there, welcome to our headache portion of our website. This is my spine. This is, well, not mine, and it's plastic, it's not real, it's not a dead guy, so relax. There are 24 bones in the spine. Each of these are bones called vertebrae, blocks, right? And in between each of these bones is a spinal disc. Spinal discs are like pads. Spinal discs are built like jelly donuts. They have a hard outer shell and a soft, gooey inner spot called the nucleus pulposus. That soft, gooey inner spot needs a blood supply. Blood brings oxygen and nutrients to every living cell, and those cells inside are no different than any other living cell. It needs oxygen and it needs blood to survive, or else it's going to die. Now, arteries don't actually pierce through the discs to bring blood there, because if the disc was full of holes, it would have no strength. How a disc survives is spinal movement. Every time you move your body, that creates a pumping mechanism that pumps the nutrients and oxygen into the cells and pumps all the bad waste products out so it can get back in the bloodstream and dumped out of your body. So without proper movement, those discs will die off. When a disc dies off, it's called degenerative disc disease, or it's also called bulging disc, herniated disc. Those are the different terms we use for a disc that's injured and torn and dying off. When you get hurt, what normally happens is you move too far, too fast, or it was some kind of sport trauma, which isn't really your fault. But listen, we work at desks for a living. Not all of us exercise nearly as much as we should. And you're probably thinking of yourself right now as I'm saying this. So if you don't have good muscular strength and good muscular control of your spine, you're going to move too far and too fast and rip something, usually the spinal disc. If you rip a spinal disc, muscles in the area will tighten up to create a brace. Kind of like if you break your arm, what do? They set your arm and then they brace it so you don't move it, because anytime there's something torn or broken, the last thing you want to do is move it around, because you're going to make it even more torn and broken. So muscles in the area tighten up, and that's great in the beginning. What happens though is the person eventually has to heal. Now, in an initial stage of injury, sometimes patients have tremendous amounts of pain. There's actually 5 steps towards taking care of any neck pain, back pain problem. And the first step is relief of symptoms. Now, if a person has bad enough neck pain when they come to my office, we're going to do an immediate referral to a neurologist or an orthopedist to help get you some pain medication to help manage the pain symptoms. A lot of times people come into the office and their pain isn't bad enough to require that, and let's hope so. But the first thing you need to do is control a person's symptoms. And I'm not a fan of using medication to treat pain, but if people are in enough pain and they have to live, they got to sleep, they got to work, medication is going to work faster than anything else, including my hands. So we've got to control symptoms. But the second and third thing that you need to do is begin the healing process properly. If people heal well, they have a very small chance of re-injury in the future, unless they have something that happens as bad as the first time they got hurt. Obviously, if you got hurt playing football and then 2 years later you got hit just as hard, you're going to have the same injury. But if you don't heal well, it turns into a problem where you keep having pain, you keep having dysfunction, and becomes a chronic pain issue, which if left untreated long enough will become a permanent pain issue, and that you don't want. So you need to control symptoms with medications. But what happens the second and third step is you have to control healing, so the body heals properly, the joints are working, the muscles are working well, and the patient gets better. Muscles that are tight, that brace a joint, they don't get blood inside of them very well, because muscles like a rock, blood can't get inside. So those muscle fibers will start to get small tears and rips in them. When muscle gets injured, it heals up with scar tissue, which is fine. Scar tissue is very thick, so it doesn't allow the muscle to stretch anymore, so you lose flexibility. It doesn't allow the muscle to fatten, so you lose strength. You'll know scar tissue in a muscle because if you ever rub somebody's shoulders and you feel those bumps, those lumps, those are knots. Knots are nothing more than scar tissue inside of a muscle. Now, that scar tissue doesn't allow the muscle to work very well, so it's not going to allow that joint to move properly. Why is that important? We already talked about how these discs require movement to stay alive. And if you have muscles that are all knotted up and scar tissued up, they're not going to allow normal joint movement, and that spinal disc is not going to get the blood and oxygen it needs. It's going to start to die off, and you could have potentially a chronic condition that will eventually result in you having to have surgery to dig that disc out and fuse those 2 bones together. That you do not want to happen to you. So what needs to be done after an injury is the joints have to be gently mobilized, and the muscle tissue has to be worked out, and you need to break up the scar tissue so the muscle regains its normal strength and flexibility. And that's how you properly treat somebody's problem, so that not only does the pain go away, but it stays away. So what is the main problem with neck pain and headaches? Well, neck pain and headaches is not like the low back. Usually the low back is from somebody lifting or pulling something that's too heavy and they rip and tear something and are in tremendous amounts of pain. Most of the time, neck pain and headache problems are from poor posture. People sitting at a computer like this all day. Why is that a problem? Well, if somebody carries, your head weighs about 16, 20 pounds, depending on how brilliant you are, right? Now, actually, it has nothing to do with how smart you are, but it does weigh 16 to 20 pounds. If that weight rests on the spinal discs, then you don't really have very much of a problem. The spinal discs can easily handle the weight of somebody's head. But if you sit at a computer desk like this all day, that head is now in front of your spine, and that head is going to pull down on your spine for however long you're at that computer desk for. Now, the muscles that attach from your shoulders to your head, they are made to move your head around. They are not made to hold the head up like this for 8 hours a day. Those muscles have a tremendous amount of strain trying to pull that head back when you're sitting like this, and those muscles get strained, they get ripped and torn, and they get scar tissue that builds up on the rips and tears, and those are knots. When you feel a knot in somebody's shoulders, that's scar tissue built up in that muscle that's being overused and abused trying to keep the person's head up because they refuse to not sit at a computer like this. Also, there are nerves that come out of the back of the head that go up the skull, up the back of the skull. Those nerves go right through these muscles that help hold the head up. So if those nerves go through the muscles and the muscles become really tight, they can begin to pinch those nerves and give you pain that runs up the back of your head, and that's a very, very common cause of headaches. It's called occipital nerve entrapment. And the research suggests that by treating occipital nerve entrapment using painkillers, you can resolve a good deal of headaches. Now, you don't want to just use painkillers to treat that. You want to release the nerve, because if you just use painkillers, you're covering up the problem. Eventually, the painkillers won't work. The study was just trying to find out what actually causes headaches. And it found by using painkillers on that nerve area, they were able to relieve a lot of headaches, which were obviously being caused by pressure on that nerve from the muscles being so tight. The other thing is, if you use nerve blocks on these joints in the upper part of the neck, you will relieve a good deal of headaches as well. As a matter of fact, most headaches can be relieved by either nerve blocks in these joints or nerve block on that nerve that runs up the back of the head. Nerve blocks are just injected painkiller. Well, does that mean you have to keep getting injections the rest of your life? No, that would be foolish. But what it does tell us is neck pain and headaches are caused by irritations with these joints up top that are being caused by jamming those joints, sitting in a computer in terrible posture all day. How you treat somebody like that is use hands-on techniques to break up all the scar tissue in those muscles that surround the bottom of their skull, that go all the way down to the top of their shoulders, and then teach them to sit at their computer properly so they don't keep beating up the neck muscles, they don't keep inflaming the joints of their neck, and keep trapping that very important nerve that goes up the back of the head, and the neck pain and headaches go away. Now, if somebody sits like this all day and you just want to crack their neck and that's it, you're not going to get rid of the muscular tension, you're not going to get rid of the entrapment of that nerve, and you're not going to help these joints move better for very long if you don't release all the knots and scar tissue in the muscles that hold people's head up, and if you don't teach them to sit at a computer desk properly. That's why I don't use the cracking techniques for neck pain and headaches. Also, there's not a lot of protection in the cervical spine. This is the neck. So to twist somebody's neck, it really is an increased chance of injury. You could sprain their neck so they can't move their head for a week. You can make the headaches worse. I find that neck cracking techniques they're not tolerated well by patients, and there's much better ways to release the pressure and strain in the back of your neck to get rid of the neck pain and headaches safely and easily. So that's my spiel about neck pain and headaches. Hope you enjoyed it. If you want to know if this is what's wrong with you, and if we can easily take care of your neck pain and headaches without twisting and cracking your neck in a safe, gentle, easy to tolerate way, please give the office a call. The number, if you click on the Contact Us tab or the Office Coupon tab, you should click on the Office Coupon tab because it has our number there. It will have directions to the office so you can find us from your doorstep to our doorstep. It has a link to download initial forms, so that way you can get the forms done ahead of time. You don't have to do them in the office, it saves time. And it is also a link to the present promotion that we're using that month to get a inexpensive way of finding out if the problems that you're having in your neck and headaches is a problem that we can treat in the office. Of course, we have a very good network of orthopedists and neurologists we can refer you to if your problem is not something that can be treated in our office. So either way, if you come to our office, you're eventually going to get your problem taken care of. It may not be by me, but at least you'll get better. So thanks for listening to my neck pain lecture. Hope it wasn't too boring. Enjoy your day. Hopefully I'll meet you one day in the future. Bye-bye now.